In Tannehill's book, she writes about reparative therapy and brings up some important facts about the topic. Many of you may know reparative therapy by its other name, conversion therapy. This is a range of dangerous and discredited practices that falsely claim to change a person's sexual orientation or gender identity or expression. So it's been rejected by mainstream medical and mental health organizations. The UCLA School of Law estimates that 20,000 LGBT youth currently between the ages of 13 and 17 will be subject to conversion therapy by a licensed healthcare professional before they reach the age of 18. And just so you're aware, Idaho doesn't have a state law or a policy regarding conversion therapy, meaning that it's legal for it to be performed here. So we're going to explore some facts about reparative or conversion therapy. Once again, we'll be talking about some heavy topics such as suicide, so please be mindful of that as you listen to this lecture. Fact 1. Transgender and gender nonconforming youth do better in homes that are accepting and supportive of their gender identity. The best indicator of positive mental health outcomes in LGBT youth is familial support. Reparative therapy does not promote familial support. Fact 2. By the time a transgender youth reaches adolescence, it is very unlikely that their gender identity will change. As we talked about in the last lecture, children with cross-gender identification after puberty rarely change their minds. Fact 3. There is no widely accepted evidence that upbringing can make someone gay or transgender. So far, there's been no evidence that the environment that somebody is raised in can make them gay or transgender. Instead, evidence has shown that biological origins best explain sexual orientation and gender. Fact 4. According to a recent study, religious counseling makes sexual minorities more likely to attempt suicide. The Williams Institute found that gay and lesbian people who underwent religious counseling were more likely than those who received no therapy at all to complete suicide. Fact 5. The APA considers reparative therapy or coercive behavior modification on transgender adolescents to be harmful. Reparative therapy is viewed as unethical. It tends to succeed in shaming the individuals back into their birth-assigned gender. Although at first, reparative therapy may seem successful because the person is responding to a lot of positive reinforcement for returning to their sex assigned at birth, one of two things typically happens. They either end up in therapy, attempting to cope with the shame and the guilt, have to wade through self-forgiveness and start to acknowledge their authentic gender identity, or they attempt suicide. Fact 6. Depression is a result of gender dysphoria and discrimination, not the cause. Transgender people indeed tend to suffer from higher rates of depression compared to cisgender people. However, this is likely the result of minority stress, discrimination, and lack of access to supportive health care. No major medical or mental health organization supports treating gender dysphoria primarily as a symptom rather than the cause of depression. Fact 7. There is a large volume of peer-reviewed evidence supporting the potential biological origins of gender identity. So while we don't fully understand the origins of gender identity, the evidence has shown that biology likely plays an important role. Recent studies have shown that brain differences and possibly different combinations of genes influence whether someone is transgender. Fact 8. Transition regret is rare. Most studies show that transition regret rests at about 4%, and most estimates place it at around 1 or 2%. While this might seem high, regret related to other forms of surgery, such as cosmetic surgery, is as high as 65%. So with this logic, other surgeries such as gastric bypass and rhinoplasty should be disallowed before medical transition. Fact 9. Laws banning reparative therapy on minors will not force therapists to railroad gender nonconforming children into transitioning. Therapists are there to responsibly and ethically support people's exploration of their gender identity without forcing them to pick a particular track. They can't force people to transition, and it would be wrong for them to do so. Therapists are there to offer support and help, not to follow a checklist for transitioning. Fact 10. Laws banning reparative therapy on minors do not affect clergy or religious counseling. For example, California's law banning reparative therapy defines those who are affected as mental health providers, meaning a physician and a surgeon specializing in psychiatry, psychologist, psychological assistant, intern or trainee, a licensed marriage and family therapist, intern or trainee, a licensed educational psychologist, school psychologist, social worker, a licensed professional clinical counselor, intern or trainee, or any other person designated as a mental health professional under California law and regulation. So clergy are not licensed by the state, so they're exempt.